So let's talk about the other kind of therapy. Basically, there's biomedical therapy. Because if you believe that mental illness is caused by things like your brain or your body or your chemistry, then talk therapy is not going to really help. What you really need is ways to change and balance that chemistry again. So we're going to talk about several different kinds of biomedical therapy: drugs, electroconvulsive therapy, magnetic impulses, surgery, and finally psychiatrists, which we don't really talk about. Basically, psychiatrists are different from psychotherapists in that they are able to administer drugs, right? So psychotherapists cannot administer drugs, and so psychiatrists combine talk therapy with drug therapy. So that's all you need to know about that group. And finally, we're going to end on a discussion about how to prevent mental illnesses. Okay, so let's move on to drugs. We know that drug therapy has been pretty big in the last 20 years. Drug companies have been coming up with newer, better and better, fancier, more expensive ways to treat common illnesses like depression, sadness, mood disorders, anxiety. Most of you have seen commercials on TV where everything's like brightly colored, lots of flowers and plants and people smiling, and it's because they took a certain drug, right? So let's talk about the different kinds of drug therapy first, what we call psychopharmacology, and that's using drugs to change brain biology and also the related behavior. We're going to talk briefly about brain stimulations. Basically, it's called ECT, electroconvulsive therapy. So let's start with drugs. So how is it that we could first figure out whether psychopharmacology, the drugs you take, are considered positive and helpful? So we have to look at first the normal recovery rates of untreated patients, right? You want to see a control group, people who don't take the drug. How long does it take them to feel better? And secondly, we have to make sure there's no placebo effect. And one way to do that is using the double-blind procedure. We talked about the double-blind last class, which is the idea that the person doing this experiment, the giving you the drug, doesn't know this condition you're in, nor do you, the person taking the drug. One reason this is helpful is because sometimes if I, the experimenter, know what condition you are, I might misidentify or I might see things that are there. For example, so if you're taking the drug that supposedly helps you feel better, I might treat you and expect you to feel better, right? So I might say, oh, how are you feeling? You look much better. Do you feel better? So these are kind of the attitudes, implicit, like secretly, subconsciously, I'm kind of acting out to the patient that might elicit a better response. So that's a problem with a single blind study. With a double-blind study, the experimenter doesn't know which condition they're in, then that kind of bias from the experimenter kind of disappears and plays a much smaller role. So we're going to talk about four categories of drugs: antipsychotic drugs, anti-anxiety, antidepressants, and finally mood-stabilizing drugs. Let's start with the antipsychotic drugs. And basically, these are drugs that are treated to treat psychoses like schizophrenia, and its discovery is actually very accidental. People who have doctors treating schizophrenia were just giving lots of different kinds of drugs to patients, and they accidentally kind of found the positive effects of one class of drugs, chlorpromazine, also known as thorazine. And basically what this kind of drug is to kind of increase the level of dopamine in people's brains. So we talked about how people in schizophrenia had a dangerously imbalanced amount of dopamine. Basically they have an excess amount of dopamine. So it's like their brain is in overdrive and they have too much dopamine, too much gas basically. And so they kind of have these delusional thoughts, easily excited ideas, their emotions are kind of difficult to control. And so they found that giving them a drug that lowers the amount of dopamine in the brain can help control that kind of level of psychoses. You might understand that there's other diseases related to low levels of dopamine in the brain. Basically things like Parkinson's. When people have Parkinson's, they have a dangerously low level of dopamine in the brain, and that leads to things like difficulty controlling your motor functions, your hands start shaking, or that you just have long periods of just kind of stable dullness, like you become very calm and you find it hard to move. Other issues with an over excess of antipsychotic drugs is what we call tardive dyskinesia. Basically, this is an illness where involuntary movements of the facial muscles, tongue, and limbs. So people get lots of tics. They can't control when their mouth suddenly starts grinning, and that's an issue of too little dopamine over time. Now, those are people with positive symptoms, right? Again, we talked about positive symptoms that are additional symptoms, things that add on to your normal functioning. Like they see hallucinations, they have delusions, basically psychoses. How about the negative symptoms? People who act like they're missing something in their lives, those who have a lot of, a lack of movement, a lack of emotions, kind of just flatness of affect. In that case, you give them something like chlorazole, which probably does the opposite and tries to give you more dopamine, right? For those who've seen the movie or read the book Awakenings by Oliver Sacks, it basically describes kind of a treatment of using dopamine to control people with schizophrenia or Parkinson's disease. In that movie, it's Robin Williams and it plays like a doctor in a mental hospital. Robert De Niro's in it, and these are people with schizophrenia, and basically they're kind of drugged so much that they become very lethargic and they aren't very lucid. They can't think, right? And so, given a treatment of dopamine, what they surprisingly found was that these people became awakened from their comatose state. They became more active. They have more lucid thoughts. They could talk and dance and smile and laugh. But unfortunately, in the movie, you find out that that kind of effect is very short-lasting. After a couple months, the brain kind of gets used to that kind of level of dopamine. And so the patients regress back to a state of psychosis.